I'm Dr. Natasha Iyer. What is functional medicine? Functional medicine is the study of your body's natural functioning, all of the physiology, your biology, your genetic individuality, everything about you, and putting it back to its best function. Unlike the traditional medical model of which I was part of for many, many years, we're looking at a disease model. And so you have a sickness, you have a certain amount of presentation, you have the blood tests to support it, and then we go around diagnosing and then treating. So for example, diabetes or high blood pressure. You would meet a cutoff point, your blood test would support the diagnosis, and then we would go ahead and treat you with medication. We might tell you to do lifestyle things like diet, exercise, weight loss. I don't know that you would get specific instruction on the exact how to. Now, in functional medicine, what we would do is say, what caused this? What is wrong with your body's processes that caused this? Now, diabetes is a perfect example because now we know that not all type 2 diabetes is a pancreatic malfunction and not producing enough insulin as you get older. We now know that there's an autoimmune diabetes that sets in adulthood. And knowing the distinction between regular diabetes and autoimmune diabetes is very important. One, autoimmune disease is reversible in our field, and honest to goodness, you may not believe this, but the means, the science, the ability to reverse most autoimmune disease is here right now. The other thing about having autoimmune disease is that it sets you up for other autoimmune diseases at a much higher rate. So if you have autoimmune disease causing your diabetes and causing the wearing out of your pancreas, then we want to know this. And we want to do things slightly differently in addition to what we would normally do, which is diet, lifestyle, weight loss, managing your insulin, your blood sugar, and all of those things. So again, back to diabetes. We can predict diabetes long before you're actually diabetic. It's a state of insulin resistance. At this point, we can prevent your car from falling off the cliff, not just say, your car is heading toward a cliff, now go do something. Okay? With high blood pressure, for example, people call it essential hypertension. National Institute of Health, more than 80,000 people. And what we know is that if you remove all risk factors for heart disease, so sedentary lifestyle, smoking, obesity, and all the usual things you know about being unhealthy that set you up for high blood pressure and heart disease, well, what they showed was that if you exclude all the other obvious things, being toxic with lead, having an abnormal amount of lead in your body, sets you up for an 837% increase in risk for heart disease. So we know this and we can do something about it. So all of functional medicine, whether it's your energy, whether it's your sleep, whether it's mood, whether it's whatever symptom is wrong, we take it as a symptom. It's like the warning light in your car flashing. We want to go in and fix what is wrong. And then everything else gets better. We don't want to offer you just a regular symptom relief. If you have a headache, we're not going to just give you Tylenol. We're going to go, what is the cause of your headache? And then fix that. So that is what functional medicine is all about. In the explanatory video where I talk about my triangle concept, I'm showing you how we put it all together. And even since I made that video, there have been many more advances. So one of the other things in functional medicine is we're always looking at the current scientific advances and how it supports our practice. For example, weight loss. You know, right now there's huge huge amounts of evidence, and I'm not saying scientific papers supporting it, but anecdotal and clinical evidence for intermittent fasting, for the ketogenic diet. Dr. Jason Fung out of Ontario, for example, 55,000 positive results using intermittent fasting in the most weight-resistant patients. These are patients who've tried everything. They're on multiple medications and they're obese, and he's getting them to get rid of their body fat and get back into normal functioning and getting them off of their medication using a very simple strategy. Now, it sounds like you're starving. No, you're not. But this is the type of stuff we do here with functional medicine. And I want you to know exactly what it is and how it's different. And also that as much as I have a general one-size-fits-all approach for initial patients, sort of you walk in, you're toxic, everybody needs to be nutritionally repleted, you need to remove toxins and lower your toxic burden. That's a kind of general start to the process. And then from there, we're looking at your blood tests, your hormones, your lifestyle, your individual mental makeup, whether you're spiritual, whether you're in pain, whether you have a family history of certain things that point to other things for us to look at. And that's where we start customizing the process for you. And so I really wanted you to understand what functional medicine exactly is. It's putting your body back to its best function, like you were when you felt your best. The sad thing is that many people didn't feel their best in their 20s even. Many people are coming to me saying, I haven't felt good ever. But we want you to be the best you can be. And if you're that person, of course, it's going to take us a lot longer to figure out. I, for one, my mom smoked while she was pregnant with me. I was born at 1 pound and 14 ounces. I was given no chance to survive. Here I am. Of course, my start in this world was compromised. I didn't have the fittest, most active childhood. I couldn't be. I was fatigued a lot. I had very low endurance and stamina. I was always told, you have weak lungs. You weren't even supposed to be here. I'm in my 40s now, and I have more stamina and more endurance, and it's still a work in progress, partly because I'm not the best student, and I get frustrated with the process, but I stick to it, and each year I move ahead further than I was the year before. And then you have patients who come in, they just need a little tweak, and 4 to 6 weeks later, they're feeling like, wow. We get patients who, you know, I've got a 67-year-old who's dropped 18 pounds in her first 6 weeks with us. And 7 months later, she says, I'm back to just doing whatever I do, and the weight will not come back on. Whatever you've done with me has worked. So on that premise, functional medicine then resets you and allows you to live your life. That doesn't mean you can eat junk food, where you may once in a while if you choose, but you know, there's consequences. It means that we can reset you and teach you to do what works for you so you can keep this result long term without further stress and going backward. So this is a journey and a partnership. I assess you every 3 to 4 months ongoingly. It's not a process that ends as soon as you feel better. Why? Because life changes, your stress changes, your circumstances change. You might travel, you might have family holidays, someone might get sick, you might lose your job, and you're aging in a toxic world. So seeing you and staying in touch with you regularly helps us keep you on track. It helps us pick up very subtle trends. Very early shifts in your lab work will alert me to things that are changing. And that's how we keep you at your best forever. So functional medicine is new age medicine. It's medicine using food that works for your body, supplementing you with nutrients and vitamins maybe that work for your body, that you need extra of because of whatever it is that's going on with you. It's giving you back natural hormones to youthful levels so that you can feel and function as young as you want to. And it's preventing and reversing existing diseases that you have, knowing that it's all based in your biochemistry, your physiology, your genetics, and everything that makes you you and different from everyone else.